I'm Dr. Jill Garrett, a licensed psychologist who specializes in maternal mental health at Baptist Medical Center in Jacksonville, Florida. When I had my own daughter a handful of years ago, I was fortunate to have excellent medical care for myself and for my daughter. But as I moved through the pregnancy and postpartum period, I recognized that there wasn't a strong emotional support program in the area. Both as a psychologist and a mom, a colleague of mine, Dr. Candace Franco, and I worked to collaborate with specific OBGYNs in the area to create a maternal mental health program.
Here at Baptist Health, we're excited to be a part of the interdisciplinary collaboration to provide a full spectrum of mental health services for the perinatal service line for our patients and families.
PMAD stands for perinatal mood and/or anxiety disorder, and a PMAD is any mental health difficulty that occurs in the perinatal period. So the perinatal period is really that period of pregnancy and that first year, typically after childbirth. PMADs can occur in as many as 1 in 7 moms and 1 in 10 dads. And we recognize that there's a need for some support. And in creating our program, we focused on 2 chief areas, the first being prevention and the second being response. The first tier of prevention within our program is providing psychoeducation through in-service trainings, team meetings, and collaborations with our OBGYN providers.
In 2016, when I first met Dr. Garrett, my patients were having difficulties accessing healthcare in a timely fashion. So if a patient presented to me postpartum in acute crisis, it could take weeks or months for them to access psychology or psychiatric services. Since then, I now have a wonderful relationship with the psychology department at Baptist and psychiatry. I can refer patients early on in the pregnancy if I identify patients who have risk factors. I can consult psychology in the hospital if I identify a woman at risk in the hospital or postpartum. And access now can range from several weeks for an appointment in a patient who is fairly stable to a same-day appointment for a patient in crisis. We use the Edinburgh screening tool in the office early in the pregnancy and also postpartum to identify patients who are at risk for mood disorders and can then make timely referrals to both psychology and psychiatry as indicated.
Our maternal mental health program is set up with a behavioral health coordinator who can schedule women in a timely manner to get in based on their referral needs. As part of our second tier of treatment, women and their families are offered access to an emotional health group as well as individual therapy where they can learn more about PMAD and ways to develop their own coping strategies. For inpatients, our team responds bedside for consults to address PMAD, trauma, and loss. Once established within our program, we use evidence-based interventions informed by cognitive behavioral therapy and interpersonal therapy to help women achieve symptom relief quickly. We collaborate with referring OBGYNs and psychiatrists for the evaluation of the appropriateness of medication, and we also work with community entities that provide support groups and lactation consultants as needed. So across the board, the wait to get access to mental health treatment is too long, and as a field, we want to do better. For these particular patients, time is of the essence. So a woman who's pregnant or recently gave birth really doesn't have time to wait to be seen. And we want to take a preventative measure that's offsetting suffering anyway. So the faster we get them in, the better that ends up being for women and their families.
Results and outcomes of our program have been very successful, and they really support Baptist's mission of changing healthcare for good. We're going to continue to build and grow our program and continue to remind the patients with whom we work of Postpartum Support International's mantra, "You're not alone, you're not to blame, and with help, you'll be well."